Welcome to Cardiac Rehab. When preparing for your first day, don't worry or stress. Our staff will meet you where you are in your health and fitness and progress you as you feel comfortable. Remember to eat breakfast and take your medications as prescribed. Wear comfortable clothing with closed-toed shoes. If you are a diabetic, remember to check your fasting blood sugar, which is your sugar before you eat breakfast. Also bring your glucometer with you to cardiac rehab and have a snack packed. If you are weighing at home, write down your weight and bring that with you on your first day. Right now a mask is required during exercise. A mask can be provided if needed. You will be screened when entering the building, which will include a temperature and symptom check, along with taking your weight. Afterwards you will be directed to the staff that will work with you for the day. They will ask you for your weight, if you took your medications, if your medication has changed, and if you have any pain. If you are diabetic, you will be asked to report your fasting blood sugar before eating breakfast. Additional questions include: did you eat breakfast and did you exercise since meeting with the nurse? After all questions are asked, staff will check your blood pressure, heart rate, and if you are a diabetic you will be asked to check your pre-exercise blood sugar. When communicating with staff, please remember that this is a team effort. Your health, well-being are at the center of the process. Please let staff know if you have questions. If you are not feeling well, don't wait, alert staff right away. Your exercise will be guided by staff. Your active exercise session will involve 3 components: a warm-up, cardio, and a cool-down. The session will end with light stretching exercises. Staff may change the session according to needs or safety. The warm-up will be done at the beginning of every exercise session. It lasts between 5 to 10 minutes. It may be done on a variety of equipment. For example, slow walking around the track, using the new step on a low level, biking on easy resistance, or walking on the treadmill at a slower speed. It is described as very, very light or very light. Following warm-up will be cardio. It will last 20 to 30 minutes on the first session. There will be an increase in your work from a resting state. Your effort level will be determined by heart rate, which will be measured by staff. It may start with resting heart rate plus 20 to 30 beats per minute. Staff also use the talk test to determine effort level. Can you speak comfortably while exercising? Lastly, staff use rate of perceived exertion scale or RPE. How hard does the exercise feel? The RPE scale ranges from 6 to 20. A range of 6 to 7 is resting or sitting with no effort. A range of 8 to 10 is warm-up. You are moving but there is no increase in breathing, and it feels like an activity that can be done all day long. A range 11 to 16 is your cardio. It involves continuous movement for 20 to 60 minutes. Your breathing begins to increase and you can hold a conversation but you can't sing. A range over 16 is high-intensity exercise. It is hard to talk and hold a conversation and you are ready to quit. Cool down is done after cardio. It lasts between 5 to 10 minutes. An active cool down is recommended, which involves continuing to move at a lower effort than cardio. This means that muscles are still contracting and you are reducing the stress on the heart. You have a gradual decrease of the heart rate and blood pressure. Stretching will be done at the end of the workout because the muscles are warm. Never stretch a cold muscle. Stretching will help increase flexibility and range of motion. These exercises may be done seated or standing. On your first day, stretches will be guided by staff. The stretches will be given according to your orthopedic or surgical limitations. Always check out with staff before leaving. The checkout will include a heart rate check, a blood pressure check for the first 3 sessions, and staff asking if you are having any pain. For diabetics, post-exercise blood sugar is checked for the first 3 sessions unless abnormal readings are seen, which will require more monitoring. Additional resources available in the program include nutritional counseling and health counseling. Health counseling involves stress management, dealing with anxiety, relaxation, and other topics that may support your overall well-being. The dietitian and counselor are available for in-person or phone appointments. These appointments can be scheduled on your first day or anytime during the program. Check with cardiac rehab staff to schedule an appointment.